This is what's known as the Old Mines area of Cadet, Missouri. Located about 70 miles southwest of St. Louis, it may not be the kind of place you think you'd find state-of-the-art health care. Think again.
Welcome to the Rural Parish Mobile Clinic. We are going to be serving the poor, uninsured patients of the rural areas of the Archdiocese of St. Louis. The first, when you come in, this is our nurses station. This is our nurse, Vicki, and our nurse, Kathy. After the nurses do their intake and get the history and their chief complaint, then they'll come into this exam room. It's a full-size exam table, and the doctor will sit here. We have a nice slide out. We'll have computer, electronic medical records. We'll have the latest in all of the technologies.
The mobile clinic is the brainchild of St. Louis Archbishop Robert Carlson. Under his direction, much of the planning and execution was spearheaded by Sister Marie Paul Lockard. But beyond that, Sister Marie Paul has a special draw to the project, especially when she's working under her other title, Dr. Lockard.
I'm a religious sister of mercy of Alma, Michigan, and you know, in the 60s when religious life was changing, more of the sisters who were nurses went into medicine. And although I wasn't a nurse at that time, when I entered religious life in the early 80s, I was asked to go into medicine. I was a sister first. My prime aspiration in life was to know and love and serve the Lord. And in that, in my religious vocation, came the gift of becoming a physician. So it's really a wonderful mix.
After 20 years working as a rural physician in Minnesota, Dr. Lockard will now be running her family practice out of this mobile unit.
It is designed to take care of the working poor. So those who are trying to make it, they might have a job at McDonald's or a factory, but can't afford health insurance. And so we are taking care of anyone without insurance who is poor, and so family practice. It'll be primary care, you know, hypertension, heart disease, lung disease, you know, gastric or GI disease. It'll be anything a family practice physician can do.
The clinic is a charity-driven effort supported by donations and grants. However, all three area Catholic healthcare systems, Mercy, SSM, and Ascension, have partnered with the Archdiocese and Catholic Charities to help provide electronic medical records, specialty services, and medical supplies. In addition, Rural Parish Workers, who are already well integrated into the community, also play a role.
I'm helping to get volunteers to staff the clinic and also to get people to come to the clinic. People come to us and we have them fill out an application for our food or whatever. And on that application is a question, do you have health insurance? So we can draw from those applications and you know, tell people about the clinic.
Staffed by all volunteer doctors, nurses, and social workers, the mobile unit is starting off serving just this one parish, with the intention of branching out to other rural parishes after a few months.
And out of that parish, we'll have a regular day that we come every day to that parish so that we'll have follow-up. So the patients, if they're put on blood pressure medicines, they'll have follow-up. So it won't be just an urgent care, it will be a primary care. It's a great mission, has a lot of support, has a lot of potential to do good.